for being here today, for discussing such an important topic, one that I know has taken many years and a lot of money. We need to do what makes financial and logistical sense, and most importantly, make sure it works for veterans and VA's health care providers. I hope we are well on the way achieving this goal. However, I'm going to use my 5 minutes today to relate to another topic. It relates to an interim final rule issued by the VA last September that allows the VA to provide abortions to veterans and their dependents. Since this rule was implemented 6 months ago, the VA should be able to provide this committee with the data. Dr. Elnahal, I have several questions I want to ask you, and see if you can answer some of these. And I'm going to ask all three of them first and see if you can answer them. In the last 6 months, how many abortions has the VA facilitated, either at a medical facility or through community care? Number two, at what stage of pregnancy was each of the abortions? And number three, what exception was used for each of the abortions? Can you answer any of those three?
So, Senator, respectfully, in a public forum like this, I'm concerned about both veteran and clinician safety if I give you that information right now, but we're happy to work with you and take that for the record.
Thank you. I figured that was coming. Well, next questions, we shouldn't have privacy issues, so see if you can give me a response on these. Which VA doctors, therapists, social workers have been trained to counsel and refer veterans for abortions? How have they been trained, and how has the VA assessed their competency in women's health and prenatal care? Do you know that?
Well, Senator, we want to ensure that the folks providing these services, again, in the limited exceptions that we have as defined by the IFR, the life of the veteran, if the health of the veteran is at risk, or in situations of rape or incest. And we need trained, qualified professionals to do that. So we've rolled out training. We've begun to do that, of course, for our women's health providers, our coordinators of care for women's health, our mental health providers, where these conversations can come up, and that process is ongoing.
But haven't we changed it to where abortion at any time, not the three exceptions?
The criteria, Senator, is if, again, the veteran's life or health is at risk, or in situations of rape or incest.
Those three exceptions. Okay. All right. It's my understanding that doctors now have the option to opt out of participating in this policy. Is that true?
That is true, Senator.
Okay. How many doctors have chosen to opt out? Do you have any clue?
I don't have that information now, but we'll take that for the record and see what we can provide.
Was that included in this new rule that they could opt out?
Under the law, physicians have always had the right to opt out of care that against which they have a conscientious objection, and we made that clear through formal policy and the exact process by which they can do that. Very recently, we sent that guidance out to the field.
Yeah. Do you have any clue how much it's costing the Veterans Administration to implement this rule? Do we have any kind of report on that?
Well, the impact analysis, Senator, that we've done estimated that fewer than 1,000 veterans a year would need these services. And so we're really not talking about a significant percentage of the medical appropriations budget that we have.
Yeah. We've had this new interim law for 6 months, and I hate that we can't discuss it a little bit more. I'm curious, what prohibits us, from privacy. I understand a little bit of it, and I'm, really just wanting numbers. Last time I talked to Secretary Madonna about this, we had started abortions, and so hopefully that we can get some numbers down the road. I think there should be an obligation from the VA to do that since it was changed from the VA and not through this body. So hopefully we can discuss this and get more information in the future. Thank you. Thank you, Mr. Chairman.
Senator Brown.
Thank you, Mr. Chairman, very much. I thank you to the chairman and to Senator